think innovation is absolutely crucial. We have to keep developing, we have to keep innovating, and we have to keep making change.
I think it's all about improving quality and to thereby enable an efficient healthcare system which is patient-centred.
To see staff changing their perceptions and not being frightened anymore of age and dementia in society is excellent.
We get to see people change in front of our eyes in really short periods of time. It makes a real difference to their lives, and that's what's so rewarding.
My role within the organisation is predominantly to lead on the reduction of falls. We are all in a very cost-conscious NHS. We talk about increasing bed days for patients who have a fall, but actually that wasn't what I was interested in. It was actually the human cost it actually made to patients. One of the initiatives that I'm particularly proud is we actually introduced the red slipper socks into the organisation. Very simple approach, but what the idea of the red slipper socks is any patient that's at risk of falling are given a pair of red socks, and that alert is then immediately increased to all the staff on the ward, because immediately they know that patients are at risk of falling. I'm really pleased to be able to say that we have actually reduced falls by 16% within the trust, which is fantastic for our patients, but also we've reduced the amount of avoidable falls within the organisation by 50%, which I'm really pleased about, because it shows all the initiatives that we've actually put in are actually working.
EPAC's an electronic web-based personal assessment questionnaire. It allows patients to self-complete in privacy online in their own homes, sometimes in clinic. EPAC was originally developed in my clinic here in the urogynecology unit in Sheffield. We use it about 1,500 times a year in various specialties: colorectal, urology, gynecology. But other clinics have actually started using it now across the UK. The striking thing was a lot of patients actually said they enjoyed doing it, and that really spurred me on to think, well, actually if patients enjoy doing this, then we're going to get good compliance, good engagement, and to an extent empowerment of patients. So patients are getting involved in their own clinical care, they're getting directly involved, taking a responsibility for their own assessment. It reduces the need for face-to-face visits that sometimes don't need to occur. So 75% of our patients elect to have virtual follow-up, which means completing the questionnaire online and then having a telephone consultation with a consultant 3 months later. And the feedback has been stunning at times.
If you can train staff carers working in residential care to understand the needs, the unmet needs of people with dementia, you can prevent distressed, challenging behaviour and treatment of this with antipsychotics. And we've got this online tool that we based on the real experience of people with dementia and how staff carers. So there's a large group of people and staff carers who have begun to learn how to manage and how to support people with dementia living in their care homes without having to drug them up. The biggest effect of not just this, but other ways of enabling staff carers to support people is that staff develop stronger relationships, more person-centred relationships. They now feel much more confident about delivering the level of quality that the family caregivers need, and hopefully if they get better at this in the future, we will be able to help people live at home for longer. It's exciting to see that in an area of dementia care that is feared and people think is burdensome, there's a lot of positive people, staff, but better still, a lot of positive families.
The Hope Specialist Service is for people at risk of falls and those with COPD, and it's a one-stop shop for holistic assessment and treatment. It's been designed and developed through a real co-production approach with our volunteers and expert patients, and we pay as much attention to the determinants of ill health as we do the ill health itself. So in 2004, when I came into post, there wasn't any services for older people who were at risk of falling. Had no staff, no budget, so we set up a clinical service and we engaged expert patients and volunteers to help us design, and they now deliver with us this real patient-centred service. The clinical outcomes are phenomenal. they're life-changing. But it's more than that, it's about what that means to someone's life. Can they get to the corner shop to buy their paper now? They're the things that we actually look for outcomes. This co-production method is so entrenched in the way that I work that I have no idea how to work any other way. I don't make decisions about the service without talking to the patients.